All right, team, welcome back to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgery. I have the privilege and penance of being surrounded by our celebrity crew today. We have Celebrity Anesthesia.
What's up, guys?
And of course, Austin's formerly most beautiful man, Gilbert, PA extraordinaire. And then we have our special guest, Mitch from Emsculpt, who we're going to come back to and introduce and let you know a little bit more about him, who's taken a little time out of his day to tell us a little bit about Emsculpt. And we'll kind of get into it in a minute, why we picked this topic, post-quarantine 15, if you will.
Happy to be here.
Mitch, tell us a little bit about you. We met a couple years ago and have known each other through different stuff in the medical world, if you will.
Mm-hmm.
But now you're the spokesperson, the liaison, if you will, for Emsculpt. And don't get too much what Emsculpt is, because we're going to dive in that too a little bit. But
Sure.
Just a little bit about you. Just you're here in Austin. You've also been competing for Austin's Most Beautiful Man. And then I thought that you and Gilbert were going to have a dress off today, but I almost feel like Gilbert was scared and just threw in the towel. And he said, I thought I was going to wear scrubs so that way he wouldn't be shown up. So I don't think we didn't notice what you did there, Gilbert. You folded like a wet noodle.
It's more like an effortless
Thank you, wet noodle, Gilbert. Mitch, please, it's your turn to talk.
I will say on Gilbert's behalf, he dresses pretty dapper, so I had to come with, a little flair just in case he was trying to show me up.
For those of you that want to check out our YouTube channel, you can see that Mitch, what is that you got in your suit there? Is that is that a rose?
It's a feather.
Oh my
God.
Feather.
I don't think that I have ever seen Gilbert bring the feather. So
I was about to say the same thing. I have not seen Gilbert bust the feather out.
And for those of you that are only listening, I got my hat on, I got glasses, and the 5 o'clock shadow. Mitch has got a feather in his suit. So boom, boom, boom. There you are.
Hit me up with some sartorial suggestions.
So tell us a little bit about you, Mitch, because you've been in the aesthetic industry for years.
Yep. Since 2 weeks out of college, I was with one company for 7 years, joined BTL about 2 years ago, and Emsculpt, they're the manufacturers. My mom worked for a well-known plastic surgeon in Los Angeles, where I'm from, for 6-7 years. She's always been in aesthetics. So kind of since I was a kid, it's always been something I've loved and had interest in. And Emsculpt was one of the most exciting technologies I'd ever seen from the first month that it came to market.
What before we jump into Emsculpt here, can we get a little catch up on Celebrity Anesthesia? I think you took your first vacation, and that's why this podcast taping got pushed back a week. Because I appreciate you fitting us into your busy schedule as the only man in America traveling on a weekly basis.
God, yes, we did. We actually just got back from Santa Fe. Just made a quick little road trip, long weekend, but we hadn't done anything since Mary's injury to her knee, and then with COVID, we've been pretty much locked down around the house. So we haven't done anything since January.
Except for the trips.
Except for the trip that Mary got hurt on in January. But my wife is doing a lot better. My wife is at Your Trendy Therapist, blogger, fashion blogger extraordinaire. And
just for those of you that are wondering, we don't get any money funds for all these shameless plugs that we do for Your Trendy Therapist. So I'm just going to put that out there for any fashion bloggers that would like to take Your Trendy Therapist's spot for plugs, shameless plugs on the show.
I might get in trouble for that at home, but yeah, I mean, we're always willing to accept money.
Likewise.
Gilberto, what about you? Are you still Austin's most taken man, or has things changed on the home front? What's going on? I feel like it's been a couple of weeks since we've heard from you, so who knows what's happened?
Yeah, no, it's been a little while.
By the fact that you're not wearing a 6-piece suit, I feel like you're still taken.
No, everything's good. Everything's good. Still Austin's most taken man.
There you go.
And things on the home front are good, or is quarantine beat you guys up? What's going on there?
I'm sorry, can you repeat that?
Yeah, I mean, are you guys still good on the home front, or has quarantine beat you guys up a little bit?
Oh, no, things are good. Quarantine's been fun, as much fun as it can be. We've been spending a lot of time together and dreaming of taking weekly vacations like One Celebrity Anesthesia. Maybe we'll be able to take a little trip here soon. But yeah, just working hard.
Okay. Well, the reason I thought that this would be a great topic is I don't know about you guys, and I know Celebrity may talk to us a little bit about the marathon he's training for that he's not actually running. But for the rest of the world, I think the quarantine 15 is a real thing. And I've definitely put on a few pounds. I don't know where the rest of our listeners are in this, and hopefully I'm not the only one. But here in Austin, Texas, gyms and other workout facilities have slowly opened, but at some capacity. I've talked to a lot of people who've still been a little hesitant about gyms. If you're like myself, by this point, you got every inch of Town Lake memorized because you've gone through this so many times, which is great to get out, get some cardio, but there's some muscle functions and other things that maybe are lacking a little bit with the gyms closed. And I think for anybody who's tried to go on Amazon, I think there's a 3-month backlog on ordering weight equipment. So I thought, well, this would be a great topic to talk about Emsculpt, which Mitch alluded to a little bit ago, and we'll let him kind of tell us a little bit about Emsculpt. But this, for me, was the first large device that we actually purchased in my office because I think it's super unique. When it came on the market, there was nothing like it. This was truly the first device that focused on muscle. And in the world of plastic surgery, we've done everything from, the initial plastic surgery was skin removal, skin movement, skin rearrangement, and then we transitioned to fat reduction, fat removal, and now fat transfer. But we had never really done anything for muscle per se. And I think this was just a huge new paradigm of plastic surgery. And I'll tell you, when we first got the device, I think it was a little confusing to people because people didn't realize the difference between Cool Sculpting and some of these other fat reduction devices to Emsculpt. And it was such a new and kind of innovative way of treating the body that I think it's taken people a little while to understand exactly the benefits of this. Mitch, you want to hit us up and give us kind of the cliff notes of Emsculpt and what it does and how it's used?
Yeah, I mean, that was very well said. And really, to your point, it was the first machine ever that went beyond skin and fat, even deeper to target muscle. And kind of what we found as Emsculpt was evolving is that when you're able to positively grow and target and affect muscle, you can also reduce fat. And as a 3-in-1, 2-in-1 type machine, you're really adding a lot of value and you're truly sculpting and toning the body in a way we have never seen before. And for a very well-established plastic surgeon like Dr. Franco, being able to use this as an option for people that aren't a plastic surgery candidate, but especially post-surgery, to continue to enhance results and have the patient feel stronger and have better function is just an enormous opportunity and a really holistic approach to wellness and anti-aging.
And what can we go over what areas people can use this? Because correct me if I was wrong, its initial push was for basically abs and glutes. And we do a lot of butts, BBL stuff. So we'll circle back to whether you can do it with that or not. But that's not the only places. And I'll tell you, my number one place that I love using it is for my arms. I don't want to embarrass Celebrity and Gilberto, but you can't even fit these arms in the entire screen here.
I knew that was coming. Good Lord.
Well, it's funny because Dr. Franco actually is our after photo for all of our arm Emsculpt pictures. So he's the Emsculpt spokesperson for the guns.
There you go.
And it's funny because Travis has been making a push to be the calf specialist. It's not Gilberto because if you've listened on previous episodes, he's actually interested in getting calf implants, but maybe he doesn't need to get calf implants. He could just Emsculpt these legs.
There we go.
Absolutely. So to your point, yep, biceps, triceps are the newest addition. They're actually completely different applicators, and there's actually pulses specifically for that muscle. The calves were the next addition. There's a separate algorithm. Again, what I mean by that is because the muscles are so different, there's different contractions to maximize how they're targeted and affected. And we can also do the thighs, stomach, glutes, and even off-label hamstrings, lower back for back pain. Pretty innovative with how you can treat the body.
You hit on a point there because I know some of our patients worry about this is that for like the because you have different settings. Because for the abdomen, you can set it to not only build muscle, but also do a little bit of fat reduction. But for like our butt patients who don't want to lose any fat, you can actually change the setting so that you're only focusing on muscle building and not fat reduction. So that's something where going to the right provider can help tweak the settings depending on what you're doing and so forth.
Exactly. And something kind of cool that just came out week ago was a study for Emsculpt and visceral fat. So people were really looking at this as just a muscle machine, fat as a byproduct. And we had a study released, CT and MRI, which, as Dr. Franco can tell you, is very good science and imaging to really test and look at changes to the body. And there was about a 15% reduction in visceral fat, which is kind of the deadly, scary fat we all want to avoid. A lot of men have it in particular. So I think as more research comes out, Emsculpt is going to start being used in so many different ways that we really haven't seen, just due to the non-muscle capabilities prior.
Gilberto, as Austin's most beautiful man, if you don't mind giving away some of your beauty secrets, you've actually had Emsculpt, and can you tell us a little bit about your experience, pain, comfort, the experience itself?
Yeah, it was an amazing experience. I had it done at your office. Thank you very much. And it was really interesting. I would go in.
You're welcome, ladies of Austin.
I'd go in and your staff was really, really helpful. They would set everything up for me, and I basically would just lay down on the table, get the Emsculpt paddles attached to me, and they just turn it on, and it was 30 minutes and treatment was over. It was pretty interesting. It was a little unique sensation to have to get used to, but it was pretty interesting, and the results were pretty incredible too.
That's what's always kind of interesting to me a little bit, is because you can actually turn up the intensity depending on what people can tolerate and so forth. Mm-hmm. And the broad range of what people tolerate or don't is actually pretty interesting. And I may get some backlash from this, but men don't seem to have as high a threshold for the Emsculpt as women. Women tend to not care. They're like, if I'm going to get some nice abs, you turn that all the way up. I do not care. Yep. The all-time 100%. Record is actually one of my best friends. His name's Fernando, for anybody who knows, and so I'm calling him out on the podcast. He has the all-time record for the lowest threshold, and I think he only got to 27%. And I've never have heard or would have believed that, but I saw it with my own eyes.
Gilbert, what did you get up to?
I mean, I don't want to come off as boastful, but I got all the way up to 100%.
I think Dr. Franco did too, pretty quickly.
Yeah, no, I'm tough. I'm tough as nails. No, for sure. Let's recap a little bit just so people kind of understand. So with Emsculpt, basically it's an office procedure. You can come in. Each treatment's about 30 minutes. Obviously, some people will do multiple areas, so it could take longer if you did abdomen and butt or so forth like that. So you can do different areas in the same day, but each treatment's about 30 minutes. And then you can go home the same day, because you may have a little bit of soreness. You feel that muscle cramping, tightening when you're doing the procedure. But basically when it's done, you might have a little bit of soreness, maybe not, just depends on the specific areas. And that's kind of interesting too, how different areas. My arms were always really sore. I felt like my abdomen didn't get quite as sore, and maybe because my abdomen was already so strong, but you never know why. For different things. But one of the great benefits about it is that you can go about your day right after the procedure. So it's not like there's a ton of downtime.
Exactly. And I think there's, with the whole shift for non-invasive, obviously there's certain procedures where if you want changes, surgery, breast dogs, things that you're doing, Dr. Franco, the nose, etc. But I found that there's this difference between true non-invasive and like an Emsculpt non-invasive. An Emsculpt non-invasive meaning you can literally get the treatment, put on a bathing suit or a bikini, go to the pool, and no one will know you had anything done. So it's literally as non-invasive as it comes. No creams, no numbing, no gels, zero. And that's one of the things I think people, especially in Austin, a city where everyone's out and about, active, a lot of sunshine, they can appreciate this because it's truly not impacting the day at all, besides making you feel, tighter and stronger.
Or someone like Celebrity, this isn't going to hinder any of his travel plans. So he could still go on his 12th vacation of the quarantine next weekend if he would like to.
Exactly. His calves may be stronger to hit the gas pedal a little harder when he's driving. Get there quicker.
Sign me up. My wife actually at Your Trendy Therapist. I don't know if I mentioned that already, but no, she actually had Emsculpt done, and she had her abdomen done, and she went and had 4 treatment sessions. I was jealous because she went in, and I have not had it done. Clearly, I'm not good enough friends with Franco, but you could see results. And I mean, like visibly, like I could see that her abs were tighter and more defined. And like, she was super happy with the results afterwards. And here I was working out at the gym like a sucker.
And I think you bring up an important point, is that typically with the first treatment, you'll do a session of 4 in the first 2 weeks. And so, something, if you did like a Monday, Thursday, or something to that effect, and we can play with those days a little bit, but it's a good initial to get that first treatment. I think the other part that Mitch brings up here is realizing that it's not a BBL, it's not liposuction, it's not liposculpting. So like any of these other things, there's some trade-offs, right? So you can go about your daily business, you can do those things. Those other treatments also don't treat muscle, but you also can't expect an Emsculpt treatment of the butt to be equivalent to 1,300 cc's of fat transfer.
Exactly.
And so, trying to be realistic about what we do and don't do, because I don't want people to have false expectations and be disappointed, but it does help augment those results. Also, for people who aren't a fat transfer candidate or don't have the downtime to not sit for 6 weeks, there are some alternatives. The other flip side that I think it's important for people to understand is, I think this is a great jumpstart for those that are trying to get back into working out and jump starting. But I tell people, any exercising or working you do on your own is only going to help augment and enhance your treatment. Also, to remember, people can have results out for a long time, but because it's building muscle, it's not like you're going to see something overnight. When you go to the gym and you kill it, it's not like your body changes the next day. Those changes take gradual time. And so, it's one of these things you got to kind of keep doing. The more you do, the better your results are going to be, just like the gym.
Yep. And what's nice,
Berto or Mitch on that?
I was going to say the cool thing too is, and I know you just recently started implementing this, Dr. Franco, is you can do almost like a muscle membership program where after those initial 4, you wait up maybe 6 to 8 weeks, let the results kick in, come in for an after photo, talk about, your progress. But then you can repeat sessions on a monthly basis just to enhance and elongate the results. Emsculpt has very robust long-term data, even out to 1 year. No non-surgical body machine has ever published 1-year data. So it's profound in terms of not just permanently killing fat, but the longevity of the muscle. And people just love to take it a step further and come in every month because it's so easy. They feel strong. Their workouts are enhanced. Celebrity, you're a runner. This would only actually make you probably run faster. We've had a lot of people say that.
I don't think that's possible.
So, is he that nimble?
He's pretty
Definitely
fast.
not.
I mean,
I need all the help I can get, man.
Hey, any competitive edge, right?
That's right.
Well,
and it's legal.
I agree 100%. I think people who do, and that's why we switched to more of a membership program, because I think just like any workout, you don't get a gym membership and only go once. That doesn't really make sense. I mean, some people get memberships and only go once. That doesn't make any sense. But the idea is that the more you do, the better you're gonna be. The better you're gonna be in terms of this. So I think that's super important. Berto, any thoughts about after your treatment, stuff you like, stuff you didn't like about the Emsculpt?
No, I really like the results. What I didn't like was not being able to go back as often as I would have wanted to keep up with everything, just because my schedule's so busy and you've been using the machine a lot with your practice, so it's hard to get in there sometimes.
Well, I thought that you didn't come back because the girlfriend said no more tight abs for you. We don't want that floating around pool season in Austin. That's not true. That was made up by celebrity.
That's a conflict though, right? Because you got to be Dr. Franco's wingman. I mean,
right?
What's happening now? Is this enhancing it or hurting it now that he's got a girlfriend?
Well, he's been MIA. This is the closest I've seen to him. I sometimes drive by his condo and wave, and I'm like, I'm outside, and so people are like, hey, you don't have to stand outside the glass window anymore. I was like, oh, I don't even know if he's home. I'm just waving.
He waved back at you.
You give him 1 6-pack and then he just leaves. It's like
that's right.
Mitch, can we talk a little bit about the difference between Emsculpt and Cool Sculpting? Because when we first got the device, that was a question that people always asked. So is this like Cool
Sure.
Sculpting? And my answer was always no. This is a
Yep.
completely different target. While it does have some fat reduction, the main focus of the Emsculpt is the muscle, and I think this is a really important paradigm shift in plastic surgery for people.
Yep, absolutely. Well, Cool Sculpting did a great job of creating this non-surgical body contouring market. The device is about 12 years old now, which a lot of people don't realize. It's been here for quite some time. But to your kind of overview, Emsculpt took it a step further by really going after muscle. And that's the FDA clearance and indication, is firming, toning, lifting, creating that thickening of the muscle tissue. And then as a byproduct, pretty robust fat reduction. Some of our studies, close to 30% across the entire abdomen, which is actually more than most of the devices that just focus on fat. So what I love about it is you're getting a 2-for-1 treatment in a sense. And then you're able to do things with Emsculpt that no other system can even target whatsoever. For example, abdominal separation called diastasis recti. Emsculpt came out that it reduced it about 15% just by thickening the muscle. And then with the butt lift beyond a BBL from Dr. Franco, there's no other option, or there never was, for a non-surgical lift. When you're doing a fat machine, specifically like Cool Sculpting, you avoid the butt at all costs. You also really aren't treating the biceps like you can do with Emsculpt, or the calves. And then the last real important point, I think, is the pain relief and functionality. We have so many patients that have better posture after Emsculpt, reduce lower back pain, again, can weight lift more, can run faster. So you're getting, on top of the fat, the muscle, extra advantages of performance. So it really kind of becomes a device that has really taken the lead in the body contouring market and has just continued to run with it.
And because usually we have celebrity rein in right now about anesthesia, pain control, those things, type of things during this procedure. But this isn't even like an Althera or anything like that, where people are taking Celebrex or Xanax or anything prior to it. Because as far as I know, I've never taken anything prior to this. There's no numbing cream. There's no need for any types of pain medications or muscle relaxants prior to this. So I that's been one of my favorite things about the device, is that it's made the need for celebrity anesthesia be zero, which has been pretty amazing.
Yeah, that peace of mind, you can't put a price on it, right?
Hey, Mitch,
Yeah,
I
actually,
have a question.
go ahead.
I don't think this has been addressed, but are there any areas that can't be treated with Emsculpt?
We haven't really
Gilberto,
fully
that
evolved
requires
the system.
surgery, man.
Yeah, exactly.
Well, I was
asking for a friend, of course. I get it.
to the chest.
There's actually,
I mean, celebrities
Dr.
right
Franco
here,
did a
dude.
chest treatment. We haven't come out with the chest yet because of the heart, and even though we don't target smooth muscle, we're still at about only 40% of Emsculpt's kind of plan. So there's going to be more areas, more indications. I think there's another 6 or 7 studies still in progress right now. There is the attachment to Emsculpt, which treats the pelvic floor. So you can treat muscles, from post-pregnancy, male, female, incontinence, things of that nature, which is utilizing what we call the high intensity focused electromagnetic energy. But between that and all the other body parts mentioned, that's what we have right now. And I'm assuming we'll hopefully have more areas in the future.
I was asking on Travis's behalf.
Right.
Oh, got it. Dr. Franco, you did your pecs off label once, right?
I did, but I
How
could
was
barely
that?
fit in this shirt. So celebrity was like, "Damn, dude, the nurses won't stop staring at you. Stop working out so much." I was like, "Okay, I don't want to distract them." Celebrity, you've been awfully quiet. Any comments, thoughts, things you'd like to?
I'm just taking notes for when I get to use this thing. It sounds pretty cool. I'm actually I've talked to Dr. Franco already, and I'm excited to check it out and try it. I want to put it to the test.
So that's the cool thing.
Well, I was
Go
gonna
ahead,
say,
Doctor.
and honestly, celebrity who, if you ever want to see, you can check out his wife's Instagram, and he's often on there without a shirt, so you can see why he'd be a good candidate for it. But one of the things that's important is making sure that you're a good candidate for this, okay? And you have realistic expectations that one, it's not surgery. Two, it's not and really no plastic surgery other than if you're seeing a gastric procedure or that type of thing. It's not a weight reduction type treatment. And so, if you're looking for a weight reduction, this is not it. This in combination with a healthy lifestyle, diet, exercise, those things can be part of that regimen, but standalone, it's not. And plastic surgery in general should not fall in that category, outside of our bariatric friends in terms of those surgeries. I think also
Sure.
too, if people have a tremendous amount of loose skin, that's where I've seen people be disappointed with Emsculpt. And this is where you kind of got to be real. And whether we're talking about butt, arms, if you've lost 100 pounds and you just have a ton of loose skin, I mean, if you think about it, you'd need Arnold Schwarzenegger arms to fill all of that loose skin. And so it's just, again, being real. And this is where I think going to an office, someone that has a trained practitioner to help guide you a little bit, because Emsculpt has a lot of great benefits, but obviously, like any surgical procedure, any device, it needs to be for the right candidate. And so it's not replacing a tummy tuck. It's not replacing, full body lipo. And it's definitely not replacing, a bariatric surgery if somebody's trying to lose a ton of weight. And those are some of the areas we've seen in our office where people have come in and we've tried to redirect them to a better position, because I think then you would spend money and be disappointed because you're not going to see the results. If you're in the overweight or obese category stuff,
Sure.
it's going to be really hard to see that muscle definition, that change in your abdomen, if we don't do some of those things. So I think discussing that is super, super important with your practitioner.
Absolutely. I mean, one of the nice things is for celebrity, if you're a runner, you probably wouldn't be a candidate for a lot of body contouring treatments, but because Emsculpt is building muscle, anyone in that lower body mass index can benefit from this. And then those people that just need a little bit more definition, if they're basically the Hulk like Dr. Franco and they just want to, have even more gains. But, we've seen a good mix of some of the larger patients for the visceral fat study. What we did there is we put 2 applicators on the stomach just to treat a wider area and had successful results. With regards to the skin tightening, there's other devices that we have for tightening, but again, this is not FDA cleared for any tightening. And if it's severe laxity, you definitely are probably looking at a surgical option first, and then maybe Emsculpt post.
And that's something that's a good point you bring up. There's people who want to do this for strength training. They're getting back into the gym. Maybe they have back issues. They're trying to ramp up after an injury, and they know that they're not going to visually see a huge difference because they have some of this extra weight that they're trying to work off. But their idea is just to really kind of re-strengthen after getting back into the gym. And we've had people that are in that category. And as long as we're on the same page about what the goal is, then I think it's fine, because we do have people say, hey, I've seen real gains since I started do this, even though I know I got a few little quarantine 15 and I don't see my abs like I'd like to. I feel that I'm making improvements at the gym. And we hear that a lot. But just trying to be real with people and make sure that we have the same kind of end goal that's realistic for them.
Yep. Athletes are getting it now too, which is really cool. Rob Gronkowski, Deontay Wilder, U.S. women's national soccer team. So there's been a lot of, performance enhancement with Emsculpt legally. I think there's going to be a frontier for that potentially with building so much muscle, 20% muscle thickness in the abdomen alone.
Until Emsculpt gets banned by the Olympics is, being an unfair advantage.
Hey, delete this podcast. Delete this.
Really, really cool piece of technology, though, because you spoke to the visceral fat loss in the study from Emsculpt, and visceral fat is one of the toughest things to break down and lose. And that is the last type of fat that gets broken down in fat loss in general. So to be able to do that to me is super impressive. the other point I wanted to make is I think this is a great opportunity for people post-injury or post-surgery to come in and have something done, because me and my wife were talking about it the other day. She had an ACL repair in January, and she hasn't been able to hit the gym like she normally does. She's a workout rat too. So without being able to do that, she wants to do something, and she could still lay on a table for 30 minutes and have her abs or arms done with Emsculpt in the meantime. I think that's pretty cool.
Actually do her.
You don't lose.
Oh yeah. I would do her quads and calves actually. So if you're looking at true functionality, ACL, MCL, you put those on the quads and the calves, that's going to just rebuild that area so her physical therapy can work even faster. Someone with back pain, do the stomach and glutes to really support the core. Shoulder pain, do your biceps and triceps to maybe alleviate and build some muscle to kind of allow you to actually work out and have better mobility. So these are all kind of off label, but after, thousands, I think 300,000 treatments performed, close to 350 now. We're starting to get some really unique feedback about all of this, which is amazing.
I needed this back, 7 years ago when I was in college and I hurt my knee. As a college athlete, every day is precious, and so to have that downtime and not have something like this to help get me back into the game faster, it's.
Which bar did you fall down at that hurt your knee, Dr. Franco? It was one of those E6 bars. I know.
It was trying to sneak into Gilbert's condo. It was like trying to climb the fence, get in the window. His girlfriend's locking it. She had oiled up the stairs to try and keep me out. But that's cool. I battled through it. I dragged myself in still.
Hey, you're a better man because of it, right?
Well, let's. Any kind of closing stuff that we should make sure we hit up and people know about Emsculpt from celebrity Gilberto or Mitch?
I mean, I just want to say that I really enjoyed going through the process of the treatment myself. Again, I wish I had a little bit more time to come in and keep doing more treatments or even hitting up other muscle groups. Maybe sometime in the future we can talk about doing that. I joked around with Dr. Franco once about maybe doing a body by Emsculpt challenge where we hit up all these different muscles.
Could we do a TikTok body by Emsculpt challenge? Mitch, can we talk about that? Can we talk about this?
I'm gonna put my money on. I'm gonna have to go with Dr. Franco.
That's what I'm talking about. That's what I'm talking about.
Just because he's so competitive, I think he'll make the time to do it if it's to beat you two.
There's only so much room for celebrity to go up. He always says the sky's the limit, but I don't know. I feel like maybe he's already there. Maybe he's already floating in his hot air balloon.
There's always work to be done.
Right? I was in the operating room and celebrities, I was like, the sky's the limit, Franco. Just keep working. I was like, damn, okay, man.
Hey, you're working on Saturdays. I mean, you're like nonstop. It's amazing.
Well, I gotta reach the sky since that's what celebrity always tells me.
That's right.
Hey,
that's right.
It's great. It's great advice.
It's like one of his favorite quotes. I'm like, God damn it, celebrity.
One thing I did want to add too, just with COVID and everything happening and like you said, the gyms. I mean, I've had my gym membership on freeze even with it reopening, and the Emsculpt cord is actually 6 feet long. So a lot of doctors have been talking about this 6 foot distancing, and the fact that you can come into a room, be by yourself. The operator won't even be near your face. You can both be wearing masks if that's the protocol in the clinic. Once you're kind of getting going and you're comfortable, the operator can leave the room and just let you relax and enjoy the treatment. So it's about as safe and sterile as it comes. And there's a lot of data now coming out that, after 10 days of not working out, you start to lose, over 10% muscle. So it atrophies quickly. You can do Emsculpt and get long lasting muscle in a safe way, little fat reduction as part of it. It's kind of an ideal solution for the times.
And someone who's never, or people who are just listening, seen the Emsculpt machine, to your point, it's very sleek in terms of there's not a lot of moving pieces. So it's very easy to clean, very easy to wipe down. The paddles are very smooth, like very limited, tight paddle thing that you can wipe down extremely easily. So 100%. I think
I feel like Vanna White right now.
because just kind of closing, there's a couple other devices out there that have obviously, once there's something that set the tone of something, very unique and innovative like this, it's not going to be long before people come out and you see there's Botox and there's like 4 other different toxins on the market now. Emsculpt has felt a little bit of that pressure, and there's I don't even know the names of all of them, but there's some other devices on there, but some of them are a little bit different than yours, and I've seen some of them are just a little bit different in terms of application, how you put them on, difference in terms of some intensities and other things. And so I think I think something discuss with your provider stuff, but there's definitely some plus and minuses to everything, like anything else in life.
Yeah, and they still, the big thing with Emsculpt, which is probably most important since we're talking medical, is Emsculpt's the only device that actually has data. All these other machines have come to the market seeing kind of what Emsculpt's done, but have no published peer-reviewed studies, which is the gold standard. No effects on fat. Maybe 10 before and after photos. Emsculpt has almost 1,000. So when you're going into a provider, obviously you're going because of the doctor, the office, the reputation, but those are important questions to ask. And if a doctor's investing in equipment that's not fully validated 100%, that maybe just has a clearance that says it won't kill you, but it's not necessarily benefiting you, that's a little moment of pause perhaps. So I think part of the reason Dr. Franco invested in this, beyond being cutting edge, is there's a lot of data behind it, and we continue to produce more and more data on all different indications, which is fantastic.
What's funny is that the hardest decision our patients have when they come in for the Emsculpt is they can't decide which body parts they want to do, because they're like,
I want everything.
They want everything because they want to do
Man.
more sessions on their butt, so their butt keeps getting better, but they also, want to do other things, because we have a lot of BBL patients that our current protocols, we wait about 2 months and then we let them start doing Emsculpt, because with, some of the BBL safety, not to get us off topic, we only inject fat into the fat. So I tell people fat goes into fat, and we completely avoid the muscle because of the risk of fat emboli and a lot of safety things that Celebrity and I have talked about in past issues about this. And so, there's a whole layer that we're not treating during a BBL that now you can treat, that's only going to enhance, because as that muscle grows, I tell people you're going to push that butt out and lift that, because we didn't do anything to that muscle during the surgery.
Yep, that's a great combination. And with your membership, Dr. Franco, are you? Is it kind of easier now for patients to get more areas and really assimilate if they want to add more body parts?
100%. It's definitely easier for people to do more body parts. It's easier for people to come in monthly. It's also easier because we've made it a little bit easier where people can trade out like a facial and upgrade to an Emsculpt treatment or do some other things.
Smart.
So depending, and then also let's say because Emsculpt, as we've talked about, is going to help build you over time. So let's say if you had a wedding in 2 weeks you need to get ready for, and you wanted to trade your Emsculpt in for a facial to get ready for that wedding, because you've already been doing that for the Emsculpt for 6 months, you can do that. So we've basically tried to set it up to give people a little bit more flexibility in this day and age of all the craziness and roller coaster rides going on, to make stuff easier for people. And I feel like people have appreciated that.
So now Gilbert can go get his glutes done, because he told me offline that he's been really wanting to get the glutes done at your office.
Well, his shorts keep falling down, and I thought he was just trying to bring like the 80s back. And I was like, damn, I was going to get him a belt for his 50th birthday coming up, but maybe he doesn't need it if he does some Emsculpt.
It was his girlfriend's request.
Coming in to get my butt done, okay?
Well, Mitch, we always like to do a little something that I call factor fiction. So we'll share the heat a little bit, but factor fiction. You were at one point considered the most eligible rep in Austin.
I'm gonna say fact.
Factor fiction. A few of the other reps have told us about some incidences with you, and them being like, "Damn, that is a good-looking man." Is there any truth to those rumors? I know that those were a while back, as you're now a taken man, but back in the day.
Welcome to my world, Mitch.
Hey, that would be fact. And Dr. Franco had brought this to my attention, so he knows that this is fact.
Oh,
I can't
so you didn't even know. It was like the Austin world was surrounding. So between you and Gilbert being taken off the market, maybe Celebrity and I are gonna move up the ladder here. Sorry, Mary.
Hey, Dr. Franco, if there's anything we can do for you, if you need to borrow anything, you want to borrow my,
I
my
need a
feather
feather.
pen,
I need a feather.
I'll bring you some to the office.
That's the move right there. The feather.
Mitch, we do a little segment we like to call Behind the Bovie. Tell us, if you could tell us one thing that people would never really expect or know about Emsculpt, what would it be? One little hidden nugget.
I'd probably say the 1 year study and data that the muscle can last for a year after 4 treatments and not atrophy because it's growing new muscle fibers. And I think that's just because people are used to gym workouts and think, oh, I work out 4 times for 30 minutes. How long is this really going to last? But because this is activating 100% capability versus the gym being 30% activation, we're getting really long-term effects. Then when you start coming in for that extra monthly sessions, it's just going to propel it even further into the future. So when I mention that to people, they always have that double take, like, what do you mean it can last a year without declining? And that's what the MRI, CT, ultrasound data has undoubtedly shown.
I think the other one, and you touched on it briefly earlier, was the diastasis, treating the relaxed muscles. Because we definitely see a lot of women who don't have skin, that aren't a good tummy tuck candidate. They look great. It just drives them crazy that they got that little bit of a pooch of their belly, which is all visceral, all internal, just those muscles relax. So to that point, I think that's a great nugget. And we have someone who I think had 4 kids, and I don't know if we have her pictures up on our website yet, but pretty amazing the difference after just 4 treatments and about 6-8 weeks later. So that's when I really kind of became a believer. Again, not the same as us going in surgically and tying your muscles, but there's the difference of 30 minutes, and going back to the office versus a 4-hour surgery and being out for 6 weeks. So I think for the trade-off, it was a pretty good result.
Oh yeah. And obviously, I mean, if you can, diastasis for a lot of people that don't know, if you can basically fit a finger or 2 in between your abdomen, that's the separation. If you've had one kid, you have a high probability of having some. 2 or more, you're almost guaranteed to have a fairly severe diastasis. If you can almost kind of stick your fist into it, you need surgery at that point. But for most people that have that mild to moderate, Emsculpt is a very good option. Plus your abs can look better. Again, a little fat reduction. It's kind of like, oh, and you get this as an extra, which no one's going to complain about.
No. Can we do our quote of the day? Did we get a quote of the day?
Yeah.
Anybody?
I've got one if Gilberto does not.
Oh, you think Gilberto's not ready?
No, I wasn't saying that.
He didn't wear a suit, so I don't know.
I've got one just in case.
G, would you like to take this, or would you like to pass it off to El Capitan?
I kind of wanted to piggyback on what you said was one of Travis's favorite quotes earlier about the sky's the limit.
He says that all the time. He says that all the time.
I want to challenge that, as a matter of fact.
What?
Yeah.
Ooh.
Against the grain. All right, let's hear it.
A little quote from Paul Brandt. Don't tell me the sky's the limit when there are footprints on the moon.
Damn!
Oh,
Travis, I'm not listening to any more of your quotes, dude. No more am I listening to your quotes, because then I'm going to be like, oh, Franco, sky's the limit. I'll be like, why am I going to settle? I'm going with Gilberto. Damn. Gosh.
That was a good one, man. I can't lie. That was very good. I was trying to piggyback on our Emsculpt muscle building with a quote from The Rock. I do love a little Dwayne Johnson.
Love it.
Well, go ahead. We'll do 2. The fans want to hear a second one since footprints on the moon isn't enough. Go ahead and try and one-up him with The Rock.
I didn't say that, but The Rock did say success isn't always about greatness. It's about consistency. Consistent hard work gains success. Greatness will come.
And that's how you get footprints on the moon. Damn, you guys are like little Twinkies. I love it.
Brought it all together.
Mitch, I can't thank you enough for coming on, especially on short notice. I appreciate you. I just thought that the timing was perfect as people are trying to get back into it. And I've heard a lot of people being weary about getting into gyms, and thought this was a great, alternative option supplement. And so appreciate you dropping a few pearls of knowledge on us so thank you.
Thanks for having me, and for everyone for not wearing a sports coat. Gilbert, I know that
I love that Gilbert just chickened out from the fashion off, because I already had so many good lines for that, and he showed up in a t-shirt, and I was like, damn, just like that. He took
pity on me, and he's like, this guy, it's his first time here. I'm just going to let him have this one. I appreciate it.
Well, I want to thank everybody who's been listening to our podcast over this time. Remember, you can download us on iTunes, iHeart, Spotify, or wherever you get your favorite podcasts. You can also find us on YouTube. I also want to thank producer Donald, who we can mute on the background, so that's pretty phenomenal for us. But in all seriousness, we appreciate his help, and thanks for listening to the greatest podcast in the world, as voted by us, Plastic Surgery Untold. Boom. Thanks, guys. See ya.
See you guys.
Take care.